Welcome everyone back to the Nudge Right Talk podcast. This is our first episode for the year 2021. I'm happy that we can get back on it and doing it again. I sincerely hope that all of you had a good Christmas and holiday season. I know it wasn't the best year for some people, but I do hope that you at least ended it with something to be grateful for and be thankful for. Additionally, I would like to take this time to extend my deepest thanks to you, my listeners who would have taken the time to just listen, drop a like, share, comment on the episodes. It really meant a lot and I appreciated it. Now, before I get into this episode, I would also like to tell you that I would have started an Instagram page, the Nudge Right Talk. That'll be in the description box, of course. And on that page, I will drop a short, probably 3 to 4 minute episode about my views and how I plan to chart ahead with this channel and hopefully grow it with you guys. Now let's talk about the topic of this episode, which is healthcare. What exactly is healthcare? I'll be the first to admit that upon starting this, I quickly realized that what I thought healthcare was very wrong. It was wrong, and it caused me to, by not knowing my view of healthcare was wrong, it resulted in me doing a lot of behaviors that I shouldn't take and that I must change. So my understanding of healthcare and what the healthcare system was is simply when I get sick, I go to a clinic or a doctor, make me feel better. That's that. Straight to the point. Forgive me if I may be sounding arrogant, but I think that's what most people think when it comes to healthcare. When you get sick, go to the doctor, you feel better. Good job, healthcare. But that perception of healthcare, it leaves a lot to be desired, especially when I'm going to give you this definition. This definition that I would have come up to by looking at sources such as the World Health Organization and the NHS from England. So what they combined would describe healthcare as is the provision of medical care to individuals or communities to maintain or restore the physical, mental, and emotional well-being by trained professionals. It's kind of long, but all encapsulating definition. And right off of the bat, two things immediately jumped out to me that I didn't have in my brain space. Firstly, it was the maintenance aspect, especially like we would say, oh, I can do a little jogging or whatnot. But once it never got to the stage where I was obese, plus 200 pounds, my diet and my exercise wasn't as consistent as it should be. And speaking about brain space, I would have never considered what to do to help safeguard my mental and emotional well-being. Those things simply didn't exist for me. Even now, I all I could think about off the cuff is, oh, do some meditation. Those things I need to look up personally to be able to handle that. This, I believe, is a dangerous mindset to have. And the reason I believe that it's dangerous is because it caused me to, not look into checkups, not looking into how to, not stress myself so much. Don't be anxious. Those sorts of stuff. Additionally, if healthcare is supposed to be, healthcare is supposed to ensure that our society is safe and is productive and continues to be developing. But if myself, only looking at 1/3 of what healthcare is, can you imagine if a whole country is only focusing predominantly on that 1/3 and 2/3 of the country's healthcare is taking a shit? So I believe the first thing we must do when thinking about healthcare, when discussing healthcare, is to improve our understanding of what exactly healthcare is. Because once we know what it is, then we can chart our way forward. Now, there are many different levels of healthcare. You got primary, secondary, tertiary. I'm not going to get into all of that. I'm going to focus today's episode on primary healthcare, PHC for short, whenever you see it anywhere. And this is the healthcare in which most persons interact with when they have medical issues. When you have an illness, you would go to a clinic, you see the nurses, you see the general practitioner, pharmacist, boom, you're out. That's mostly primary health care. It focuses mostly on what they call palliative care, whereby it provides relief for pains and other symptoms of illnesses and can be said to be acute. And this approach has worked extremely well for us in terms of a society, in terms of humans, in terms of the planet, and has allowed for the development of numerous cures, numerous vaccines, and has generally resulted in the extension of human life. Hooray, hurrah, I'm actually excited. However, because it's worked so well, we're now at a crossroads where we have a planet with an ever expanding, aging population. You have the rise of non-communicable diseases. There's so many people with non-communicable diseases right now. And that one shot, take some pills, get a syringe, that's not really helpful when it comes to how far the time attacks the joints or the general degrading in eyesight and hearing, the diabetes and insulin. That type of healthcare isn't really the best at handling what societies and what human health is going to demand for the future. So, this will undoubtedly result in massive restructuring and incur large costs. Or will it? I really don't know. We have to ask ourselves then, do you know the cost of healthcare? Should healthcare be public or private? And is healthcare a right or a luxury? Those are all questions that then would come into play, because depending on how you answer these questions, it would shape how you would move forward. Now, each of those questions could be an episode for this podcast by itself, and I'm not going to answer them. I'll just leave that for you guys. I want to hear your views. Put in the comment section what do you think about these questions, and would you like it to be discussed? Comment section on Instagram, and maybe I can revisit that and have a chat about that. But regardless of how you answer these questions, I believe you can all agree that healthcare must be based on these three tenets I'm about to list. These being affordability, accessibility, and positive outcome. Because if you don't have those, then you're doing nothing. I really don't really care. Now, when we're talking about affordability, we're simply thinking about how much does it cost, my G? Why you need to pay you in order to get better? Simply, that is it. But we must also think about, why does my healthcare cost this much? What goes into making it cost this much? Should I really be paying this much for healthcare in the end? But more often than not is the case is that we don't ask these questions, and sometimes I don't know if we feel intimidated to, or we just don't know who to ask these questions to. Because depending on where you are in the world, in Barbados where I reside, my healthcare is government. It's a social program. The government takes care of that for me. Certain places, I guess like America comes to mind, insurance companies rule, insurance companies are king. And we all assume that these people, they know what they're doing and they're acting on their best to help us. No, I'm not going to say they don't know what they're doing, because I believe they have to know what they're doing. But are they acting in your best interest? Who knows? That's up for you to decide as well. I don't think so. And when we start to think about this here, then we have to know that affordability in terms of healthcare is based on two things: the type of healthcare, and then how frequently is that healthcare accessed. Simple supply and demand. Not only that, cost of innovation. Cancer innovations are going to be more costly than me changing your bandage or finding out a super absorbent form of bandage. So when it gets to that part, you're going to see obviously how affordability can change dramatically. So unfortunately, if you're one that suffers from many ailments, chances are you're going to got, if you go with insurance, higher premiums than someone who rarely gets sick. And government, they may have a population that is very young and doesn't really, got a lot of non-communicable diseases and stuff. So government expenditure on that may be low. Who knows? But I think we should try to find out more of it, because you could be paying sometimes 2 or 3 times more than what your healthcare should cost. I mean, think of it. You could be going for surgery and your insurance provider or your government tells you have to go to hospital X, and at hospital X it costs 50k. However, at hospital Z it is 30k, and there's no change in terms of the percentage of positive outcomes from this surgery. But because you don't know or you weren't able to give a voice and you thought this person was acting on your best behalf, you're now paying an extra 20k. You would have felt the same if you went to hospital Z. Therefore, can we say that the healthcare was affordable? Although the outcome was the same, I paid 50k, that person paid 30k, affordability isn't matching up there. So we need to find out these things so that we can make more informed decisions. Shifting gears to accessibility now. Accessibility is what it is. How easily can I get access to these services, to this help, to this medicine, to these clinics or whatnot? Because if there's a clinic 2 mountains over from the people who want to use it, it's not accessible, especially if there's no direct highway or something. Persons must be able to get the care that they want once they have the money for it. Because if it's not affordable, it's not going to be accessible. So if it is affordable but you can't get there, it's not accessible. I don't know if it's more of a policymaker standpoint or if private does that, but I do believe that persons should consider when constructing healthcare facilities, clinic, hospitals, that the type of services and the demographic of the area should be considered. Because an area which is high in, say, an elderly population, I would believe that they would benefit more from elderly daycares and senior citizens communities or villages than have 15 different specialists. I'm not saying that these elderly people may not need these specialists in their years, but in terms of the ratio of type of services needed versus type of services being provided, is anyone actually looking at this and evaluating, hey, we don't need this right here? If you got a young population, you probably need some pediatrics instead of, a bunch of cardiologists over there. But I do believe that should be looked into, and if it isn't, why hasn't it? And this is not to say that this will lessen healthcare in any way, like, ooh, this part has 5 hospitals, this part has 1. That doesn't decrease the standard of the healthcare. The healthcare, once it is able to provide adequately for those people there, then it can say that that healthcare system is improved because it's functioning within a good budget constraint, is not going massively over or massively under, it's provided the services needed. And then some of the money then could go into possibly enhancing the healthcare to things that are not necessarily on the most needed of the list. Now lastly, and I believe this one is probably the most important, is the outcome of the healthcare. You have decided to pay the most amount of money you could ever dream of to get better. You travel the world, but the outcome is 20%, 80% failure rate. No one cares at that point. Like, you want to be better. As I said earlier, I'm sick, I come here, make me feel better. So if it is that we're seeking these these hospitals, these clinics, we're putting all our money into it, and then we don't actually know if we're going to survive this procedure. This hospital doesn't have a good track record in doing these types of procedures. This medication is not the best at treating this symptom. We don't know this. Sometimes you gotta wonder, why is this information not available? Or is this information available and I don't know where to look? It may seem like I'm asking a lot of questions, but it's through these questions that we can then guide ourselves on what we need to do, where we need to go, and how we could possibly have a positive influence on everyone around us in terms of like, yo, you don't necessarily need to buy this brand name drug. You can go with the generic one, because the difference in success is, say, 1%, but the difference in cost is $10. The cost-based analysis there should automatically say, hey, let's focus our money then on this generic. And that may save money then to be put into another aspect of healthcare that was suffering prior. That is the type of thinking that should be going into the outcome factor of healthcare. And most of the times, your insurance company may have an excellent track record in choosing places that give you great outcomes, or your government may have the best outcomes possible, but this is self-reported. And we tend to have a positive skew when self-evaluation. So I would recommend you get some third parties evaluation. I know if you're in America, the Commonwealth Fund would be good. World Health Organization is usually global. I don't on a more local or regional level, you should do a Google search, have a look around. Maybe you'll find independent agencies and base your decisions off of those. That said, I believe no matter if you think it's public or it should be public or private, right or luxury, you want your healthcare to be affordable, accessible, and have a positive outcome when it comes to you. And that is even amplified now, unfortunately, in these current times, this pandemic. Healthcare, some people can't get access to defibrillators, they can't get hospital beds, it's not accessible, and the outcomes, some of them aren't as good as we would want. And if we take a more vested interest into our healthcare in terms of the maintenance, which is before ensuring that you do try your best not to get sick, hashtag wear a mask, hashtag social distance, and then when you do get sick, ensuring that this where you're going is clean. They have their PPEs, personal protective equipment. They have the nurses, the doctors accessible, and you have a good success rate. Those are the things we want from our healthcare. Those are the things we must demand from our healthcare. That's all. I will admit I had a great time researching for this episode and finding new information. It really broadened my horizon, and I hope that it would have had a positive impact onto you and anyone you would share this with, because it's been fun. And with that said, this has been another episode of the Nudge Right Talk podcast. Have a great day.